If you've ever experienced numbness or discomfort or tingling, lower back pain, or even urinary issues on the bike, this could be related to your pelvic health. And that's because your pelvis is like a seat for your upper body. But it's also the place that your spine connects to your lower extremities. Those big, strong, juicy legs of yours, which produce hundreds of watts of power on the bike. So understanding the pelvis and how it functions and the muscles that are involved could actually help us with reducing back pain, reducing pelvic floor dysfunctions, reducing risk of pelvic floor related issues, properly engaging the core, and a lot more. I'm Ili, strength coach for cyclists. Let's dive in. So first, let's talk about some very common pelvic issues. Number one is back pain. Virtually every cyclist has experienced that nagging back pain when you're riding long hours in the saddle, and then you start feeling the ache and the pull, and then you gotta get up and you gotta do that sketchy stretch while you're riding, and then that kind of helps relieve it for a little bit, and then you're back into position. Well, think about it. Every time that you're doing that sketchy stretch, you're essentially doing an anterior pelvic tilt. We'll talk a little bit more later about what the pelvic tilt is, but that's essentially what you're doing. So if you're experiencing lower back pain, it could be related to the positioning of your pelvis. Another thing that's common in cyclists are pelvic floor dysfunctions. So I'll talk about some symptoms that you may be experiencing, and later in the video, we'll talk about why these happen and how you can combat them. So number one is urinary incontinence. Urinary incontinence is when you are leaking tiny bits of urine during either physical exertion or laughing or sneezing, and it's fully out of your control. And it can also happen on the bike as well. And it's typically related to weak pelvic floor muscles. Pelvic pain and discomfort is number two. And this is from long rides, sitting in the saddle, causing numbness and tingling and discomfort and this heavy feeling down there. That's another thing you might be experiencing. We'll talk about all the solutions later in the video. The third thing that you may be experiencing is bowel dysfunction. So long-term strain on the pelvic floor can lead to constipation or even small amounts of bowel discharge, completely out of your control during high physical exertion. Another thing that may happen, and this is very common during pregnancy and postpartum for pregnant women, but it does happen for some cyclists as well, is prolapse. And that's when the organs in and around the pelvis drop down, leading to this feeling of heaviness or bulging in the area. And then the fifth thing is reduced core stability, because the pelvic floor is actually a part of the core muscle group, because your core is not just your six pack. Everything between here and here, everything that's keeping you stable. Weak pelvic floor equals weak core equals less stability and power translation on the bike. Now, I'm not saying all of this to scare you or to sound like some WebMD article that's telling you have some terrible disease and you're gonna die and give you health anxiety. I'm really sorry. I'm just wanting you to understand that there are risks when we don't bring awareness and train this important part of our bodies. So let's start with the lower back pain. And to understand lower back pain, we mentioned pelvic tilt. I mentioned the anterior pelvic tilt. So what is a pelvic tilt? A pelvic tilt is essentially the action of tilting the pelvis in order to maintain a neutral lumbar position. Remember, lumbar spine. Now, we see this done in the weight room for a variety of reasons and in a variety of circumstances. Think about when you're on the floor and your trainer tells you to do a posterior pelvic tilt to get your lower back to touch the floor and properly engage your core. Now, as we mentioned earlier, the pelvis is where the spine connects to the lower extremities on the bike, right? And so by learning to perform the appropriate pelvic tilt, you're able to shield your spine from improperly loaded forces and improper stability. You'll be able to produce safer movements, maintain neutral position, lift heavier, put more power on the bike, control your power on the bike, all from this one skill. What I do want you to understand is the pelvic tilt isn't just one tilt. That's because the pelvis moves in three different directions, or on three different planes: the X plane, the Y plane, and the Z plane, or what we call it in the kinesiology realm, sagittal, frontal, and transverse. And for a few of these, you're not really controlling it. When you're walking, when you're running, when you're jumping, and all that, your pelvis is moving in these different planes and you're not really doing anything about it. What you probably We'll do are anterior and posterior pelvic tilts. So let's talk about them. So for the posterior pelvic tilt, I want you to think about the top of the hip socket here, the top of the hips, which is the iliac crest. This top of the hips is going to be moving backwards. So standing here, we're moving it towards the neutral position. And this is very common in a few exercises like the core exercises that you're doing on the floor. Imagine you are bringing your lower back towards the floor. If this is the floor, bringing the lower back in and sucking in the belly button towards the spine is the common way we hear it. Now, this is great for exercises with weights done above the waist, such as a shoulder press. You know, you want to be able to maintain that pelvic tilt to create intra-abdominal pressure, to almost be like a full can of Coke. If you don't understand that reference, I'll tell you it in a little bit. And then there's anterior pelvic tilt. And this is similar to what we did earlier, you know, that sketchy thing that you do on the bike to relieve that lower back pain. So this is where the pubis symphysis, tiny little area of the pubis back here, gets pulled backwards and the hips come forward, or the iliac crest comes forward. And we're tilting it forward to neutral here to create a little bit more of an arch, because you're combating positions where you might put the lower back in less of an arch, or you might take the lower back out of lordosis. And so think about this like anytime you are performing a deadlift. You don't want to do a posterior pelvic tilt and perform the deadlift, because that's going to put forces on the spine that your spine might not ready to be dealing with. And so you do the anterior pelvic tilt and then you perform the deadlift to maintain neutral lumbar lordosis. And then there are other exercises such as the Olympic lift, where you're going up. That's going to involve a pelvic lumbar rhythm. And so you're actually changing the kind of pelvic tilt that you're doing throughout the movement. I hope that makes sense so far. I know it's a lot, but I want to emphasize that there's no one size fits all pelvic tilt for every person during every circumstance, during every exercise. Talk to your coach, see what you should be doing, because different positions and different exercises benefit from different tilts, if that makes sense. But you want to know what kind of pelvic tilt you should be performing before an exercise to ensure spinal stability and safety and maintaining a neutral spine. Now, if you are experiencing lower back pain and you're doing a pelvic tilt in the gym and you're doing the right pelvic tilt, if there is a right pelvic tilt, let's talk through a few steps that you should take to go from there. Number one, if you're experiencing lower back pain, start with a bike fit. Please get a bike fit, and not just like a regular local bike shop bike fit where they kind of eye a few things and they raise the saddle a little bit or whatever. Go get a professional bike fit from a reputable bike fitter. They're going to do a few things. They're going to do some tests. They're going to ask you about what kind of riding you do and how long you're typically out for and what you're training for, and get an intake assessment. They'll also probably pressure map to see where you are on the saddle and your sit bones and how everything is going and moving, and your torso angle, your shoulder angle, and how you are pelvic tilting, and if you are pelvic tilting and what kind of event you're training for. Oh my gosh, so many things. Go get a bike fit. The next step is core engagement. If you're not sure whether you're properly engaging your core on the bike, go ahead and check the video I made a few weeks ago. I'm linking it up here. 3 exercises that can help you. And one of the exercises is aimed at helping you create maximal intra-abdominal pressure. Imagine you have a can of Coke, which I really wish I had right now, but I just don't. But imagine you had a can of Coke. One of them is 2 cans of Coke actually. One of them is empty, you drank it, it's open, empty, nothing inside, and one of them is full and unopened. If you were to step on the empty one, can would squish. If you were to step on the full one, you would probably be able to support your weight. And so that's the idea of bracing. When we're able to create that intra-abdominal pressure straight through the core and that proximal stiffness, we're actually able to perform a lot of the exercises that we need to without putting stress on other parts of the body like the spine. Same thing here. If you can create intra-abdominal pressure through the core, you can support insane amounts of torque and forces on your body. If you don't have strength in the core, kiss it goodbye. The third step for checking out back pain and seeing what we can do there is looking at your cadence. Are you lugging the pedals at 60 or 70 RPM for hours at a time? That's a lot of torque. Remember, power equals force times velocity. If you're trying to maintain a specific power and your velocity is low, your force is going to have to compensate and go higher. And thus, a lot of force is going to put a lot of pressure in the joints, in the hip socket, in the knee, on the spine. Whereas maintaining a quicker velocity above 80, 90 RPM can help relieve some of that pressure. 4, start adding strength training to your routine. And I'm not just talking about going and doing squats and deadlifts, but learn how to do some upper body work as well to compensate, you know, training the lats, training the chest, training the shoulders. All of these can actually help with lower back pain. Not just that, breathing, proper diaphragmatic, full rib expansion breathing, which we'll talk about a little bit later, and pelvic floor exercises, which we'll also talk about in just a second. And if you're doing all of those things and you're still experiencing lower back pain, then I will pray for you. Okay, so I've alluded to the pelvic floor. So what is the pelvic floor? The pelvic floor is a group of muscles that are at the floor of your pelvis. And they are literally supporting everything down there, almost like a hammock. They're holding your organs in place, and they're involved in a few things: urination, bowel movements, and sexual function. Now, obviously, if you're a cyclist, you're on the saddle, this tiny little triangle, and you're sitting on it for a long period of time, it puts a lot of pressure on this tiny little area called the perineum. It's the area between the tailbone and the pubis, the pubic bone, and it's just bearing this constant pressure, and that can lead to numbness and tingling on the bike. So interestingly enough, cyclists are more at risk for pelvic floor dysfunctions than others. In fact, a 2021 study called "Is Cycling Practice Related to Men's Pelvic Floor Dysfunction? A Hypothesis Generating Observational Study" found that men aged 25 to 70 who were cycling for at least a year, the longer years of cycling correlated to a higher risk of UTIs, or urinary tract infections, due to pelvic floor dysfunctions. Not just that, we've also read about pelvic floor affecting the prostate and recovery times following a prostate surgery. And again, there's all the other things we mentioned before: the urinary incontinence, the bowel dysfunctions, sexual health. Clearly, the pelvic floor is important. What can we do to fix it? All right, let's start with something called Kegels. No, not the seagulls from Nemo, Kegels. Now, Kegels are exercises that are intended to contract and relax muscles down here in the pelvic floor. They do take a little bit of mind-muscle connection. So if you feel like you're not getting this, it's just because your mind is not big. No, I'm joking. It's just because you haven't made that connection yet. Motor unit connections. Have grace with yourself. It'll take some time to get. But I can guarantee you that you've probably used these muscles before. Anytime you've tried to stop a fart from coming out, you have contracted the muscles. Anytime that you are stopping yourself from urinating, you're contracting the muscles. Hop in bed, lie down, just lying down on your back, and imagine yourself probably, hopefully after you've used the washroom, otherwise you might get a fun little surprise, but imagine yourself on your back and tense the muscles. You feel them in your mind, feel yourself contracting the muscles, and then relax them for a few seconds. The first few times you do this, you might not be contracting them super hard. That's fine, but it'll get easier and easier, just like every other muscle does in the gym. You'll make those adaptations, you'll learn to control them. You can start doing them in different positions. You can do it standing, you can do it squatting, maybe not. You can do it seated or in different stretches like child's pose. Now, I do want to highlight that these exercises, Kegels, aren't for everyone, so use them with caution. I don't know if they are right for you at this specific time in your life with whatever you're specifically going through. So if you are dealing with any of the things that we talked about earlier, real moment here, if you are dealing with any of the pelvic floor dysfunctions, the incontinence, the bowel dysfunctions, all of those things, they're not fun. Don't be embarrassed and don't be ashamed. They are common. It's okay not to be okay. You're allowed to go through these. Talk with your healthcare provider. If they recommend you go see a pelvic health specialist, go see a pelvic health specialist. I don't know whether these are right for you. I'm not prescribing anything. I'm just walking you through information. Someone more specialized in this area can help more than I can, especially if you're going through something like prolapse as well. So don't be ashamed, go seek help. All right, the second thing we can do here is breathing exercises. And that's because the pelvic floor and the diaphragm, they're neighbors. You know, they're in contact with each other. And so learning to breathe and expand the diaphragm and open up the rib cage laterally and then bring them back in, and emptying the diaphragm and getting all the air out can actually help with the pelvic floor as well. So a few different options you can do. Breathing video that I'm linking up above that I recorded a few weeks ago to help with that. There are 3 specific breathing exercises. Sphinx breathing specifically as well could help with the pelvic floor function and health. Next up, this is something your bike fitter will go over with you, but your saddle. Remember, it's tiny, it's a triangle. I don't know where your sit bones are. I don't know where your perineum is. You're probably different than I am. I don't know how much pressure you're putting on the saddle. I don't know if more is holding your right side than your left side. I don't know if it's too far forward or too far back. Go see a bike fitter. They're going to run these tests and measurements and choose the right saddle for you, because maybe, just maybe, all of these pelvic floor problems that you're having, you just have the wrong saddle. And thank God that would be the reason. All right, finally, some small tips just here and there at the end to reduce discomfort on the saddle and to help keep your pelvic floor and your pelvis healthy. Take regular breaks and shift your positions every once in a while. Don't stay entire time in one position, pedaling, pedaling, pedaling. Chill, break, stand every once in a while to release some of that pressure, and this will make a huge difference. Try to avoid spending long hours in the saddle. I know this is not possible for everybody, but if it is, try to avoid it. And I'm talking long hours. I'm not talking 1 or 2, like I'm saying 5 or 6. I know during base season, we're trying to get as many hours as we can. So if you are in that specific season, good quality pair of bibs can help. And investing in a good quality pair of bibs goes a long way. Don't skimp out here. Don't pinch pennies on your bibs. Pinch pennies elsewhere, not for coaching. Pinch pennies elsewhere, because your health and your fitness are your greatest investment. And you probably want to win races and feel younger and faster and stronger than you did 20 years ago. I can help with that. Let me know. I'd be happy to talk. But anyways, finally, do some stretches, do the breathing exercises. If it's appropriate, do the Kegels. All of these things together are going to help you with pelvic health and just feeling overall better on the bike. Engaging your core more, feeling less pain and discomfort and tingling, and being a well-rounded cyclist. So there you go. Your pelvis, great, strong stuff. How do I end this off? If you're experiencing any of the stuff we talked about earlier, prolapse or UI or anything, go see a doctor, go see a pelvic floor specialist. You don't wanna miss out on these things or procrastinate them too long. Hope that this was insightful in some way. Catch you next time.